Hello, today we're going to talk about the effects of anesthesia on patients with mitochondrial disease. So starting off, uh, what is mitochondrial myopathies? And these are structural and functional mutations in the mitochondria. The primary target is the central nervous system, the liver, but it can be a range of different organs that it primarily targets. It's mainly organs that require a lot of energy that you would see these mutations. Continuing, what are some of the symptoms of mitochondrial disease? There's seizure, early stroke, meaning that a lot of these patients with mitochondrial disease, they're mutations that occur and manifest themselves when they're children, young adults. You'll know if you have a mitochondrial disease early on. So early stroke, peripheral neuropathy, cardiomyopathy, Fanconi syndrome, which is really inadequate reabsorption in the proximal renal tubes of the kidney. Another place where you would see a lot of consolidated mitochondria, intestinal obstructions, and diabetes. Um, so continuing on, how do these affect these anesthetics affect the mitochondria? Well, primarily they just worsen the symptoms of the individual's disease. Um, you know, if you have a respiratory problem and that is because of a mitochondrial disease, um, if you take an inhalant of, you know, let's just say isoflurane or something like that, it is you inhale, that will worsen the asthma, that will worsen any kind of immediate lung issues that are there. And mainly what is happening is just the inhibition of, generating ATP that we see in the mitochondria. And when these are inhibited, there's multiple different complexes that can be inhibited, multiple different avenues that each disease can present itself in the mitochondria, and the mutations where they are can be a mutation in the complex. It can be a mutation in cytochrome. It could be a mutation in all these different transporters of electrons and things like that. So continuing, the risks for those with mitochondrial disease and the mitigation on how to do that. Primarily, if we're talking a young adult that knows that they have mitochondrial disease, it's the physician's duty to understand that and be able to address that. And early on, when you have children that have yet to be diagnosed, or right off the bat something's going on, you have a premature birth and you don't see the symptoms per se right off the bat, it's hard to have that medical history to be able to address that, and a physician to be able to see on his feet or her feet that okay, this is what's going on. And there's a lot of studies that's been happening for many years now that it's easier to diagnose, it's easier to see these things manifest themselves and know what to do. So if you're having to fix a preemie's kidney, like one of the tubules are just not correctly, might not be bound correctly to the kidney, and you put them under sedation and you notice that they're respiring a whole lot, they're going to respiratory ketoacidosis, they're doing things that normally they shouldn't. So a physician would be able to address this and know right off the bat, okay, I don't need to be giving them inhalants. I don't need to be giving them, you know, a drip of propofol or anything like that. I need to be giving them a bolus of something immediate. And these are ways that physicians are able to mitigate a lot of the risk factors for people that are going, under and being able to have a proficient surgery. So there's other things that go along also with this that it needs to be addressed. So you have a mitochondrial disease, but you might not know that you are more susceptible to asthma. You might not know that you might have some weird cardiovascular things going on. It's important to be able to not only diagnose early on, but it's also to be able to know that you have asthma, know that you have respiratory issues, because these inhalants that they use for anesthesia will worsen those symptoms, and you don't want to, die on the operating table. So the types of mitochondrial diseases, So first off, uh, you have propofol infusion syndrome, and this is known to affect the mitochondria. It's PRIS for short, and this is a clinical syndrome, and there's really no therapeutic relief for these, and it's just mainly not using propofol. Um, but once again, you have to have that recorded in your medical history to be able to address it. The second one is Malaise syndrome, and this is just a mitochondrial dysfunction seen by lactic acidosis. So the focal general this disease has like focal and generalized seizures, dementia, recurrent headaches, vomiting, um, and more or less you'll see this as an onset later on in life. And it's once again important to be able to see this and diagnose it and be able to go from there, because yes, you're going to be when you're on the operating table, you're going to react differently to certain anesthetics because you're already at a predisposition to not be able to have functioning mitochondria. And with the anesthetics, that just further, and it's been seen to further inhibit mitochondrial function. And then you have Leigh disease, and this disease is characterized by progressive neurodegenerative course, and it has subacute necrotizing encephalopathies. And this can be generally seen in children with developmental delays, seizures, ataxia, and the combination when you have a patient with Leigh disease and you put them under anesthesia, you have to be really worried about respiratory failure and death, because if their O2 sats go well below normal, they can die, and they're more predisposed to have these issues. Then you have propionic acidemia. Excuse me. This is a mutation, and it is a deficiency of activity in the mitochondrial enzyme propionyl-CoA carboxylase. And this carboxylase functions as part of the catabolic pathway for um, fatty chains, cholesterol, amino acids, threonine, methionine, isoleucine, and valine. The most common symptom of this is ketoacidosis, and this is because the propionic acid inhibits the citric acid cycle enzymes. So once again, if you have this disease, you're already predisposed to have low functioning mitochondria, and it is, you have to know the certain drugs that will be appropriate to not further inhibit the mitochondria, even though, it might be easier to, let's say, do a drip, do an inhalation. These patients will not be able to really function properly on those drugs, and it's important to be able to give the appropriate drug so you have a procedure that is a healthy outcome. And then the last one is Alzheimer's disease, and this is primarily seen with inhalation of isoflurane, and so it induces capsaicin activation and apoptosis, and this just primarily means that mitochondrial function is being inhibited in some capacity. So you have apoptosis of certain cells because mitochondria is inhibited. So you have, your proton gradient is being inhibited, and so then you have apoptosis because the cell is not functional. And if you give this isoflurane, it will worsen the symptoms of this Alzheimer's disease, and end up, they're more predisposed to be able to die on the operating table. And that is something that you need to understand when physicians and even the patient have the understanding of, okay, this is what's going to happen if I am taking this drug to go under. And the parents, well, not necessarily the parents if you have Alzheimer's, but the family members will need to be able to know this and have it, in their medical history, be able to talk with a physician to have a good procedure. So continuing, we have why is there a need to be cautious with anesthetics in patients with MD? So respiratory problems right off the bat. If you have respiratory problems, it will be heightened with inhalations and other things besides a bolus for anesthetic purposes. If you have cardiovascular issues, you need to be already aware of what's going on and how to address these when you are needing an operation. Generally, like I said earlier, there's anywhere that there's a consolidation of mitochondria, the heart, the liver, there will be, that's where most of the symptoms will manifest themselves, because that's primarily where the mutations will occur because of the abundance of mitochondria. Um, so in conclusion, it's important to just know your medical history, understand that people that have MD are going to be more predisposed to have issues getting operations done, and be able to uh, really, as a patient, know what I need. And also, so when you get the confirmation from the doctor, you'll have confidence in his abilities, you'll have confidence in the surgery as a whole. Appreciate you.